So, as many as you know, this is Brittany, my PA, and what we're going to start to do is we're going to do a little bit of injections in the prezygomatic space because she's a little flat right here. But we're also going to do the deep pyriform space because that's going to bring out her midface a little bit. And also the deep pyriform space goes all the way up to the tear trough in the midface. So that's going to be a great correction there. So we're going to do these two areas. I'm going to use contour for this. When you're doing the prezygomatic space, you need to come almost behind the patient. So I like to use a lift point to get into that prezygomatic space. I'm using the lift point, and I go just through the skin, and I do a tap, 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 and I tap as I'm inserting. I just go through the dermis, okay? And now I enter the pilot hole, and now I'm lifting up. I've got to lift up to help me get through that smaz. And I'm going to do a twisting motion, and now I pop through the smaz. How I can tell is if I lift up on the cannula, I can't see the outline of the cannula. Now I'm pushing up against that zygomatic cutaneous ligament right here. Remember, the prezygomatic space is bounded inferiorly by the zygomatico-cutaneous ligament, the orbital retaining ligament superiorly, the periosteum deeply, and that smaz superficially. And so now I'm just going to inject very slowly about 0.3 in her prezygomatic space. This is going to help the upper cheek here. And it should be rather pain-free and rather safe. You do not want to penetrate through the zygomatico-cutaneous ligament, or you will get the infraorbital nerve and foramen. So now we're going to do the state-of-the-art injection of the deep pyriform space. And what I mean by that is I'm going to look for the angular artery, see if it's there, and see what depth it is, and then plan accordingly to where the angular artery is. So first I'm going to go on her patient's left side, and I'm going to see the angular artery sitting right here. And so let's freeze it. Let's go back a little bit. So here's the angular artery right here, and that's well off the periosteum. So we know that that's safe to inject deep to that. So let's do the other side. And you can see right here that the angular artery is also well off the periosteum. Here's the angular artery right here. Here's the periosteum. And so we can inject deep to it without any risk of occlusion. So now we're going to do the injection in the deep pyriform space. That injection is down straight to bone, and it's just lateral to the nares. So I'm going with lift. I'm going straight down to the bone. I'm going to do a little bit of aspiration, but I know that I don't really need to do that. And then I'm going to inject down into the bone. I'm going to do about 0.3 in her case. Okay, so that's deep pyriform space number 1. I'm going to change the needle so that it's nice and sharp, and if I want to aspirate, it's unprimed. Okay, so now we're going to do it the same over here. We'll get the ring out of the way. I'm going to go straight down into bone, straight down into bone. We'll do a minor aspiration, and then we're going to inject down into the bone about 0.3. You see that this whole process doesn't take more than a minute or two. I'm watching for skin changes, but I'm very confident with the ultrasound finding that this is safe. And now we're done. So now what I'm going to do is I'm going to confirm placement of the filler in the Pyriform, and I'm using sterile gel there, sterile ultrasound gel. And you can see over here, very similarly, here's the artery, the angular artery, and here's the filler below. Perfect position. So that's state-of-the-art way to inject the Pyriform completely safely using ultrasound assistance.